that how a little bit of in the realm of technology enhanced education and learning, and this is one area that is still a lot need to be explored, but I can share what we have been doing. I would like to say it's a work of many people who are working with me at SimKit simulation program and in my department. These are some of my data. This, without listening to the tips that Hisham has provided, I'm starting with the storytelling. I'm following you well. So what I would say that in this fast-paced world of healthcare, where we all, as seasoned healthcare provider, and I would say not only doctors but also nurses and various other professions face an ever-growing challenge. Pakistan now, and there are many reasons for that. For because the technology has advanced, the medical field has evolved. There are complex procedures are happening, and especially in our field in emergency medicine, it's always unexpected what will happen the next minute. So traditionally, what used to happen that we learn whatever patient we get on our shift. So those learning or those patient presentation become our opportunities to learn. The first time I learned how to intubate a newborn is that I was lucky enough in my house job, first month of rotation, that a preterm baby arrived and become apneic, and that was my opportunity to learn how to intubate a preterm baby. But now, if I reflect, it was a safe environment for me as a learner. Probably not. Probably there may be a better way. How we those who are in on call with we you all can remember. I know this transition now from those cell phones up till the smartphones, and I would say I learned how to intubate in this way, but now they are handheld video laryngoscopy devices which I was never trained, and I have to learn while working as a staff physician. So, what I would say, I would argue that simulation turns practice into mastery learning in various ways. And now, with the invention or having a lot of technology support, you can enhance further learning as well as engagement. So, my three learning objective for today's talk is what is gamification, what is its impact on learning, a little bit about escape room, and at the end, I will see if I can talk much about virtual simulation. I will just want to give you an idea, very higher level overview, and if the time allows, later I will ask Hisham to organize kind of a workshop kind of format where I can tell you in more detail. So if we look at the pediatric emergency medicine, I would say even the emergency, I'm taking examples of them just because of my specialty, but it doesn't mean I'm dismissing other acute care specialties. Any acute care specialty is focused always on managing acutely ill children. And for us, the stakes are high because this is how our emergencies look like, very chaotic. So we have to make rapid clinical decision under time pressure. Time is brain, time is heart, time is like a septic shock bundle and all those things. Secondly, we need to have this specialized knowledge of various, like if you are emergency physician, but I noticed here today even somebody is expert in AI, somebody is in point of care ultrasound, and as I myself in simulation. So we always have to thrive to get more and more knowledge, and it has been already told we cannot function alone being an emergency physician managing a lot of emergency situations. So we have to work in as an effective team, and unfortunately in our med school, in our before we get into the hospital setting, nobody talked much about the teamwork. Nobody told us, like literally when I joined first day of my house job, I was kind of in a shock that, oh, how I will talk to my nurses, how I will coordinate the calls, how I will coordinate the consultation, which is kind of a new world for me. So now come to gamification. So if we look at the word gamification, anyone who have kids of teenage age will know it very well. Our whole struggle is how can we reduce their screen time and game time. So basically, gamification refers to the application of game design elements like points, up challenges in the context of, and rewards as well into the non-game context. And today, as we are all from healthcare, I'm talking about in the healthcare education. And in simulation based learning, this approach helps motivation, engagement, and retain that emotional connection. Similarly, a connection that will reduce the anxiety or have a fun fact also make it connected emotionally and then make you learn and engage more. And if you look or ask me why gamification, Jabin, so I would say based on the literature, and this literature is not very old. It's a 1 decade old literature that learners today are not like us. They often prefer interactive participatory learning over traditional didactics. So gamification support experiential learning by creating a safe, competitive, and motivating environment. And if you look at the evidence, which I'm going to show you a little bit later, 2 or 3 studies which shows that section not only the team with trusted and they are supported, but the most liked theory, and this is the learners first engage thinking and communication into a structured, gamified environment. And each challenge or puzzle is mapped to a specific learning work, learning about application, learning about the protocols, etc. So why it is important? So a hands-on experience, which is a escape room, not only simulate real-world medical challenges, but also provide a huge engagement as well as active problem solving and decision making, make them to work in a duration in the real room are usually three: safety instruction, journal process, and the games specific goals, and a background story as we give it to our learners that this is the topic or this is a scenario we are going to do today. The gameplay mechanics, which is the game begin with the doors being locked and a time or find out clues to solve puzzles and advance with the game. And at the last is the game conclusion, where when if the time is up or if the group has reaches to the goal, and then it is followed by there are many types of puzzles which are there, and you can see certain pictures. They can be word solving puzzle, logic puzzle, physical puzzle, combination of to actually provide them a codes of numbers as we see it in our daily records. And new can be simple as are this escape here. A lockbox that opens when students arrange them in a correct way. And what we found that there's a hue that any educational activity will does, but then there's a engagement, as you can see from all the comments that we get. So how we apply this learning to PEM? Currently, in the room for PEM, collections or to other countries which I'm working. So local contextualization is very, very important. So my summary or key takeaways are gamification and technology enhanced learning does enhance engagement. It improves your experiential learning, but there's a huge emphasis on thoughtful implementation. It's not that this is in fashion and you will do it for everything. It need a thorough, thoughtful like discussion among your team members that what are the objectives or gap you are trying to solve. And there's a research still need to happen in this area that how you will measure the outcome. This is a barcode of our SICKIT simulation program. If you want to follow us on LinkedIn, please do follow and keep updated what we are doing at our SIMKIT Simulation Center. And then if you want to connect and learn more about the areas that I have mentioned, I'm very happy to be contacted. And this is the barcode for my LinkedIn page. I appreciate the patience listening and to stay up a little bit later because we were a little bit running short on time. Thank you so much, Megan.
Thank you, Javeen. That's a brilliant talk to end the day on. Thank you. A fascinating insight into the use of simulation and your escape rooms. I am now going to move on to some awards and prizes. Let me just share my screen, if it will do it. There. Yeah, there we go. So we're just going to go through the conference awards for today. Honestly, fantastic talks by everybody. Thank you very much for taking the time and effort to bring forward from the abstract presentation today. It goes to Dr. Joseph Chaplin from Hampshire Hospitals. A very interesting presentation of Foundation Sim, so thank you. Presentations. So in first place is Dr. Jasmine Blake with her poster on cross-border emergency response systems case studies from the EU and the ASEAN. You will receive, as will everybody else who's received an award today, you will receive a additional certificate along with your attendance certificate. The second prize for poster goes to Mohammed Shiraz for his abstract on cracking the code to rib fractures management in the UK DGH. So well done to you. And the final third prize for East Poster goes to Aisha Farouk for her abstract presentation on bilateral valonic infarctions due to artery percheron occlusion in a rare stroke presentation. So well done to all four of our prize winners. As I said, you will all receive a additional certificate for your portfolios. I am going to stop sharing my screen. To me. Right. So that concludes the Emergency Physician International Conference for 2025. I would once again like to thank the entire organising and scientific committee members for their tireless effort, dedication and professionalism in bringing together what has been a fantastic afternoon of shared learning. As I mentioned earlier, a huge thank you to those of you who have taken the time to present to us today. Your insight and knowledge has been invaluable, and I think I can safely say on behalf of everyone that we have learned a great deal from you all. I think all the clapping hands moving up the screen reflect that. No learning event would be complete without a feedback form, so please do take the time to complete it. whilst today's talks are fresh in your minds, you will receive an attendance certificate for your portfolios once you've completed the feedback. You can find the form through your individual learning accounts where you initially logged on and joined the conference. And those should be available. If you can do them as soon as possible, and then your certificate should be available in the next 24 hours or so. Finally, before you all disappear, thank you to you all for having attended today. We hope you've enjoyed everything that we had on for offer, and we look forward to seeing you again at the 5th EPIC conference in 2026. So enjoy the rest of your days, everybody. Thank you.
Thank you so much, Megan, and thank you, Hisham, for your leadership and organization. It's very well organized.
Thank you, Javine.